Interim Executive Vice President and Dean of the Faculties of Health Sciences and Medicine here at CUIMC. Dean Rustgi?
Thank you so much, Maura. While I can't emulate your enthusiasm, I'm going to try my best. But more so, it's really an honor to be on this event and to recognize during Nursing Week that indeed probably the most critical health professional is the nursing professional. Nurses, nurse practitioners, and other health professional workers. We have absolutely, under Dean Frazier's leadership, absolutely the best school of nursing in the country. A round of applause for Dean Frazier. And you know, I think you'll hear repeatedly from patients, not only in our setting, but throughout the country, that our nurses and nurse practitioners and others make a tremendous difference on a daily basis, on a constant basis with patient care and family care. So while we have this week to acknowledge our nursing colleagues, it's really every day that we want to acknowledge all that's done and all that they've accomplished. So thank you, and look forward to the event this morning.
Thank you, Anil. And welcome, everyone. I'm thrilled to be here to honor our nurses. I'm Dean Frazier from the School of Nursing, and I'm thrilled to be here, especially during National Nurses Week. The experiences of the past year, we faced two twin pandemics, right? COVID and racism, changed us as a school, as a community, as a professional, and as individuals. During this time, nursing has taken center stage, with the COVID crisis shining that spotlight on us and the contributions that nursing has made to society. We've been acknowledged for our courage and for putting our lives on the line to help others who were stricken with COVID, and for our compassion in the face of this tragedy. But to those of us in the profession, really, this is nothing new. We are, in fact, standing by the commitment that each one of us made when we became a nurse. No matter what is happening in the world, no matter what the circumstances are, we are going to be there. Nurses have a history of putting the patient first, and this pandemic has been no exception. When it first hit New York City, many of our nurses were redeployed to work in COVID units that required them to be retrained, and this called for flexibility, agility, and the ability to transfer and learn new skills and techniques, patience, determination, and most of all, compassion. And many of our nurses worked long shifts with COVID patients, only to go home to their families and make sure that they were also safe. And it took a toll, both mentally and physically, but your resilience helped get you through. I hear a family in there. You guys could mute. We're always glad to hear families, and we're glad to get to know them during this time. Our nurses are remarkable. They are ready, prepared, and committed, and they will continue to be committed in the future. That's what nursing is. I could not be more proud of what our nurses bring to the lives of their patients every single day. Thank you all. I want to acknowledge Stephen Ferrara, Associate Dean of Clinical Affairs, and Maura Abbott, Assistant Professor of Nursing, who worked tirelessly to coordinate the COVID testing via the Cold, Cough, and Fever Clinic on the onset of the pandemic. Without their dedication, we could not have accomplished the continuity of many essential services while staff were deployed elsewhere. And I would like also to thank Dean Rustgi and CUIMC leadership for their support and for helping to secure the resources that nurses needed to do their part at this extraordinary time. So in closing, this week, as we celebrate Nurses Week, we pay tribute to the nurses' commitment and to the nurses' central role in the healthcare system structure and the essence of healthcare. My hope is that our collective voice as a profession will continue not just to be heard, but will be accorded ever more resonance and influence. and that our expertise and leadership will not just be sought out, but will be celebrated for generations and centuries to come. Thank you.
Thank you, Dean Frazier. I would like to now introduce Dr. Donna Lynn, the Senior Vice President and Chief Operating Officer of CUIMC and the CEO for Columbia Doctors. Dr. Lynn?
Thank you, Maura, and good morning to everybody. And I'm really honored to be part of this event honoring CUIMC nurses during National Nurses Week. As you know, we employ about 400 nurses in our organization, the majority of whom are actually nurse practitioners. And that doesn't include the thousands of nurses that are employed by our partner, New York Presbyterian. But the anchor for many of our nurses and for nurses across the country is the School of Nursing. So my hat's off to Dean Frazier and to everybody who is training some of the most critical healthcare workers that we have in the country. And I noted yesterday that for the 19th year in a row, nurses have been ranked as the most trusted profession in the country. So hats off to all of you. We've got a lot of accomplishments in the School of Nursing. The first to award a master's degree in nurse midwifery, and the first nursing school to require all faculty to establish either a clinical or a research program. I think you all know about our wonderful US News and World Report ranking of number 5. And the school also ranks number 4 in NIH funding. So these accomplishments wouldn't be possible without both the leadership, but also all of the wonderful students that we bring into the School of Nursing. Just as a personal note, while I have great confidence in physicians, I benefited personally from the nurse midwives here in New York. All 3 of my children were birthed by midwives and at home. So really made a significant contribution to my maternity experience. So I know for decades, this school has been able to meet the challenges that have been brought forth to them, no more so than in this past year. We know we owe an immense gratitude to our nurses who really not only worked, as Lorraine said, in fever and cough clinics, but quite frankly, who we redeployed into some very difficult situations. So thank you for everything that you've done to support us from a research and education, and importantly, from a clinical perspective. So hats off to you.
Thank you, Dr. Lynn, so much. Dr. Homma will be joining us a little bit later, so I'm going to turn this over to Dr. Stephen Ferrara, who is my colleague at the School of Nursing and is the Associate Dean for Clinical Affairs. Stephen?
Thank you so much, and good morning, everyone. It's my pleasure to be here. I thought I'd start with a little history of National Nurses Week because I wanted to just get some understanding. So it begins on May 6th and ends on May 12th, which is Florence Nightingale's birthday. And these permanent dates enhance planning and position National Nurses Week as an established recognition event. And you can Google today Nurses Week and find all the places that nurses can get a free cup of coffee, a free donut, and a number of other benefits for being a nurse. There are over 4 million nurses in the United States right now, and I will honestly say I'm so proud to be amongst those 4 million and with all of you. My next part here, and I'm going to go into our slideshow, since why not? We have here. So we have this wonderful slideshow. I'm really building it up because I helped put it together. But the photos of the nurses and nurse practitioners at CUIMC is just amazing. I've been at CUIMC for 7 years. I know I haven't met the majority of nurses, but I want to now. And once we get past this pandemic, we will have some event where we can all get together. And for all the chairs, thank you for those who are here on the on the call now. And also thank you for those who were able to send a quote. We know that there was lots of emails going back and forth and everybody's extremely busy. So with that, I am going to share my screen and we will show our all right, can I get a thumbs up if we can see? Yes, all right, fantastic. And I'm gonna play a song in the background so you hear that. Okay, here we go. Here's to the ones that don't ever take credit. Here's to the ones that won't admit it. I hope you know we're all thanking God for you. And here's to the ones on call all night. Don't think twice about the sacrifice. Here's to the extra mile that you take it to. Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to laugh, but you did just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. If everybody laughed like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. No, no. You give it all like there ain't much to it. Fire's all around and you walk right through it. I hope you know we're all thanking God for you. Yeah, there's not enough words to say. You're a hero in every way. So I raise my glass for everything that you do. Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to laugh, but you did just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. If everybody laughed like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. No, no. Thank you, thank you. Just didn't have to. Thank you, thank you. Just didn't have to. Here's to the frontline warriors, to being brave for all of us. So the song runs shorter than the slideshow because we got so many wonderful photos from the various departments. And again, I thank everybody for sending in these photos and really participating in the day. Maura, back to you.
I think we have a couple of more slides to go on, right?
Yes, we do.
And here we go. So these are our chair quotes now coming through. And then at the end, we have a very special slide to a very special colleague.
Yeah, so just please stay tuned and just a few more slides to go.
Enjoy this lovely recognition from our physician colleagues. Well, we finished a lot earlier than I thought we would finish. So thank you all again for taking the time to get on with us this morning, and be looking for more events coming up in the future. Thank you again to our panelists for taking the time out of your busy schedule and offering those wonderful words to the chairpersons who are on here. Thank you again. And again, to all of our nursing colleagues, thank you so much for all that you do on a daily basis, and enjoy your week. Goodbye, everybody. Have a wonderful Friday.
Bye.
Thank you. Bye-bye.
Thank
Bye.
you.
Turn right.